Hello, everyone, and welcome to the latest edition of the Laser Skin Surgery Center webinar series. I am very excited that today we are here with the esteemed Dr. Roy Geronemus. Hi, Dr. Geronemus.
Good evening, or good afternoon where you are.
Yes, or it might be any time when you're watching the recording. But thank you so much for tuning in. I see a lot of you joining right now, so we'll just give you all a minute or two to get situated. Today, Dr. Geronemus is going to be speaking about scars, how to improve them with lasers and related technology. He's going to be speaking about all types of scars, acne scars, surgery scars, injury scars. A lot of us suffer from having scars for one reason or another. They're some of the most challenging conditions to treat. And probably almost every day, Dr. Geronemus helps someone that was told that their scar was untreatable. So I'm very excited for him to share his knowledge and hopefully give you all some good advice and directions and hope that for how to treat your own scars.
Well, thanks, Risa.
Yeah, so if you guys, after the end of his presentation, we'll have some time for Q&A. So if you're on Zoom, there is a Q&A feature that you can use to populate any questions, and we'll try and get to those at the end. We are available now for in-person and virtual consultations. So wherever you're tuning in from around the world, you do have Dr. Geronemus or any of his esteemed dermatologists at Laser Skin Surgery Center to consult with about your specific scars. And before I turn it over to Dr. Geronemus, in case you are not familiar with who he is a very esteemed board certified dermatologist. He is the medical director for Laser Skin Surgery Center of New York. We also have a location in Southampton, and we treat all types of dermatologic medical conditions, skin cancer. We offer Mohs surgery and all types of cosmetic procedures as well, because we have over 100 lasers in the practice. So without further ado, Dr. Geronemus, take it away.
So the treatment of scarring is something that's come out of my interest in lasers and related technologies over the years. I've been working with lasers since the mid-1980s, and the laser technology and other technologies as well have evolved and have allowed us to treat a variety of conditions, many of which relates to different types of scars, and scars can vary. And with all the different technologies that we have, and we have over 100 in our practice, we're able to use many of them, as you'll see in this presentation, for a variety of different scars. So it's a growing problem, and it's become a much bigger part of our practice. So many of us, if not most of us, have scars, and it's often a sign of our past. But there's so much that we can do about these scars to make them better. Not that we can cure scars or make them go away completely, but as you'll see, there's a lot that can be done for a variety of different scars. And you know, if you look at one's past in your own body, this is just a little cartoon showing, you know, how over one's life things happen, whether it be something that relates to an injury or something medical where you required surgery, or something cosmetic that you've done, or just something that happens spontaneously, whether it be from acne or something like acne scarring. These are all problems that can lead to permanent marks on the skin and things that we can typically address. And scars play a different role in culture. Sometimes scars can be used as a sign of valor, as you can see from this African tribe on the upper left. And, you know, in culture, you could also have seen scars as part of cinema to depict various different characters. And you also have unfortunate scars following cancer surgery, which can often mean that this is a long-lasting reminder of a problem that you had in the past. But in the cultures, scars look different to different people. There is definitely a stereotype difference between men and women, where many men can get away with scars, but many women cannot. And depending upon where the surgery is and how they feel about them. But by and large, you know, even with the feeling that many men can accept their scars. There are many men who cannot as well and would like to have their scars improved, and we'll talk about that. So there are different types of scars that we see. In general, there are red scars, what we call erythematous scars, hyperpigmented or dark scars, light scars where the skin is whiter than normal, either fully loss of pigmentation or partially loss of pigmentation, scars that are more superficial, scars that are thicker above the skin surface, scars that are depressed, and scars that are contracted where your tendons or your skin may not move very well. And these scars can come, as we know, from trauma or surgery, acne, burns, or even stretch marks are really scars when you think about it. So we mix and match our lasers or technology based upon the type of scar that the patient has and the skin type that the patient has. So if somebody has a red scar that's flat versus a dark scar that's raised, I will treat those scars differently. Someone comes in and has fair iris skin, we treat it differently than somebody who comes in that's African American. So based upon the type of skin that one has to mix and match the technology to make sure that the appropriate treatment is being offered. Now there's a basic difference in philosophy that we have now at the Laser and Skin Surgery Center of New York, which varies from what the conventional wisdom in medicine has been historically. Many times you'll go to a surgeon and have a procedure done, and you'll come back and say, well, my scar is red or my scar is thick. I don't like the way the scar looks. It's depressed. And the surgeon will commonly say, well, let's just sit tight. Let's wait a year or so. Let everything settle down. Well, our philosophy is different. We believe that early intervention can make a very big difference in terms of the length of time that you have that scar, and also improving how that scar looks over the long term. And we'll get into that as well. So the different lasers that we have fall into different categories. We have vascular lasers. These came out of our work, the work that we do for birthmarks and blood vessels on the skin. We use this quite a bit for treatment of red scars, scars that are early in their development that haven't yet turned white in color. And there's scars that are pigmented, dark, more common in patients who have darker skin types. And there's scars that lasers that we use that are resurfacing lasers, what we call ablative lasers that wound the skin, non-ablative lasers that don't wound the skin. And most of these lasers are fractional, meaning that we're treating part of the skin surface, but not the entire skin surface, anywhere from 10% to 70% of the skin surface, leaving normal skin behind. And this allows for a tremendous degree of safety in treating the skin itself or the scars. So these are just an example or examples of different lasers that we use, and I'll be running through these. The pulse dye laser, sometimes called the V-beam or the Prima, the fractional lasers, whether it be the Fraxel Laser, and there are different types of Fraxel lasers, the clear and brilliant, the Laser MD, and the fractional ablative lasers like the Fraxel Repair, the Core Laser, and the other lasers made by Cyton. KTP laser for redness, a picosecond laser, which can treat some scarring without any real downtime, YAG lasers, ablative and non-ablative lasers, as I mentioned. And there's some non-lasers that we use as well, such as radio frequency with microneedling, and something new called rapid acoustic pulse technology that was just FDA cleared yesterday for cellulite that has the potential to be used for scars as well. And I think we'll be hearing a lot more about that in the next year or two. So let's start with one of the more common scars that we see in our practice. And this is a hypertrophic or red scar. And this is something that is usually elevated and red at the same time. This can occur within weeks after surgery or weeks after a procedure. And our philosophy, again, is not to wait, but to intervene very early. So what I'll do with a scar like this is I will initiate treatment with a pulse dye laser like the V-beam, and the response can be quite good. We treat every week to 3 weeks, depending upon the type of scar that the patient has. And we can get this degree of flattening that you see here. And we'll also add injections in the treatment of the patient's skin, and the injections can help flatten the scars. This is a woman who had a facelift. We do a lot of facelift scars where the scar was thick, and you can see how it flattened after the treatment, became significantly softer and lighter, and we could continue to treat this. Very easy, fast treatment, just takes a matter of seconds, but it does require multiple treatments in an effort to flatten these scars and make them look better. When scars are thick like this, they're often symptomatic and they can itch. So early intervention with the laser technique plus the injections can be very, very helpful in minimizing the symptoms that one experiences when they have a thick scar like that. Now, this unfortunate woman had a chemical peel done to sun damage on her hands, which we could have treated very easily with a laser for the dark spots on her hands, but unfortunately, a chemical peel went awry, and she ended up with these scars. And you can see the dramatic difference, leaving her with essentially normal skin with early intervention with the pulse dye laser plus injections, and quite remarkable here that we're able to remove these scars without any residual change in texture or any loss of pigmentation. That's not always possible. This is one of our better results. I wish every patient would end up looking this good, but this is an example of what can be done if things go well and as expected. Another example of a burn scar on a woman's face, pre and post treatment. And you can see we brought this redness down with the injections, and some thickness has been softened. Here at this point, we can go on and continue to treat this patient further with a resurfacing laser to bring back some of this pigmentation and to return some of improve the texture as well. So I look forward to doing that for this particular patient. And severe burn scars often require a combination of laser therapy, injections, and surgery. This woman had a combination of little skin grafting around the mouth and laser treatment over the rest of the face and neck, which brought these unfortunate burn scars down to a much more normal appearance that made her significantly better. In other scars, we combine treatments. Here we use primarily pulse dye laser, and you can also use a pigmented laser to remove this pigmentation here. Injections can treat this type of thickening, and these treatments are very simple. They do not take long. The recovery is not difficult. You may get some bruising, but nothing that's significantly difficult, for the patient themselves. So for a procedure like this is a red scar on somebody's thigh. This procedure just takes a matter of seconds. No anesthesia is required for this treatment. If somebody wants, we can give a topical anesthetic like Emla, which would work quite well. The laser itself uses a cooling spray that's delivered prior to each laser pulse, and that takes away a lot of discomfort. Now, if this patient came back to me and wanted to continue to treat, I would use one of our pigmented lasers or pigmented lesion lasers that could remove this residual pigmentation. I would use something either like the Fraxel Laser, LaserMD, or Clear and Brilliant, which will work quite well to remove this residual pigment that one sees here. So these are quick, simple, easy treatments, but they do require multiple treatment sessions. Now, the others, as I mentioned, the other question is, when do you begin treatment? So I'm not of the mindset that you wait a year, let things settle down, but I do feel that if we can get to patients early on when the scar is beginning to become thick, that is the ideal time. So we have this debate with the plastic surgeons as to when to begin to approach their patients, but I feel that if you can begin early while the scar is beginning to form and is relatively immature, then you do get a faster response and a more complete response as well. So for dark scars, I was mentioning that we use these non-ablative lasers. We also use lasers known as Q-switched or picosecond lasers. So again, we mix and match the treatment based upon the type of scar or the type of pigment that a patient has. Now, this is a kid who has this greenish scar under his eye. So he was playing around with an older sibling who had was painting something green in the house and whacked his little brother and left this green tattoo under here. And here we used a Picosure laser, a Picosecond laser. And this is after a single treatment session. You can see the green's completely gone, pre and post treatment. So no reason to cut this. Just a simple laser treatment worked out quite well. And that's a single treatment session, which in all fairness is a bit of an exception. We don't always do that well in a single treatment session. There's a patient who had a traumatic tattoo where a mortar shell blew up near him while he was in the service. And you can see pre and post treatment, where pre here, you can see the ink here that left the scarring, and then afterwards with using a Q-switch laser, a rather dramatic response. Now, hyperpigmentation is a very common problem, particularly amongst people with darker skin types. And this is one area where we have changed our approach, and our results have gotten dramatically better in the past several years. And there's a newer concept that we've been doing using low energy, low density, non-ablative, non-wounding fractional lasers, just treating 10% of the skin surface. And we use this as a means to promote this concept called laser-assisted drug delivery. And what this does is this opens up little channels in the skin and allows the penetration of a topical solution that lightens the skin, and that allows for increased absorption of that solution, so we get increased benefit from the laser treatment itself. So you're combining the laser plus the drug as part of the same treatment, and patients continue to use the topical drugs afterwards, after the treatments, to get further lightening. This again requires multiple treatments, but very, very helpful for pigmentation of the skin as a result of injury or surgery. Here's a woman who had an abdominoplasty. This is a tummy tuck. We're not quite done with her, but you get some idea of the type of thing that we can do to improve the appearance. And this is using this concept of the non-ablative fractional laser plus the laser-assisted drug delivery with a topical solution. In this case, we use something called tranexamic acid topically that can be very, very helpful. That medicine can also be given by mouth, which can also help pigmentation of the skin as well. Another example here of another tummy tuck scar, pre and post treatment. Very, very low density, barely touching the skin surface, but enough to allow penetration of the topical drug, which can lighten the scar, as you can see here. So a very common problem to see dark scars, particularly on the legs, and also in patients with darker skin. Some scars turn white. This patient had a laser treatment for a birthmark. You can see on the left, he was left with these white spots here. We use something called an eczema laser. Doesn't wound the skin, but it stimulated the pigmentation to come back. And I've seen this gentleman now 15 years after this photograph was taken, and the pigmentation that returned has maintained itself. It's still there. So this seems to be a permanent cure for what we thought was a permanent problem. We can't do this routinely for all patients where pigmentation has been lost, but it is something that can be done quite nicely. And this is a patient where a fractional laser, this is the Fraxel Laser, was used to treat this white pigmentation. Still a little bit red from the last treatment, but you can see the pigmentation is returning. This is a patient who had a tattoo. This was an anchor on the leg, treated with a laser, leaving some whitening of the skin. And after a series of these fractional laser treatments, fractional laser, Erbium Laser, you can see the return of pigmentation, something that can help improve the outcome from certain types of procedures. Now, one area that we see very commonly, a very big part of our practice, is the treatment of acne scars. And there are a variety of options for acne scars. One of the more common treatments that we offer is the Fraxel Laser, one of them. There are different types. And this, you can see the smoothing out of the skin. This typically requires multiple treatments. It's a non-ablative or non-wounding laser. This does require a topical anesthetic to numb the skin. Sometimes we'll give some pain medicine as well. The skin turns a little bit red after each treatment session. And then within a few days to a week, there may be some mild pinkness or redness, but the patient's able to go back to normal activity. Or in the case of a woman, wear makeup right away, that's fine too, or a concealer. But we do treat these patients typically at a monthly basis. But these are generally broad types of scars, mildly atrophic or depressed, and they do quite well. other types of scars we'll treat differently. Here's a patient with darker skin, and in this case, we use that lower density, lower energy laser I talked about. In this case would be either the Clear and Brilliant or the Laze MD. Both work quite nicely for improving the texture as well as the pigmentation in the scar as well. In this case, we actually chose a picosecond laser, which can do the same thing using like a fractional handpiece. So there's essentially no downtime with a procedure like this, just some mild redness after each treatment session. But as you can see here, required multiple treatments with 7 treatments to get to that point. In cases where we have deeper scars, we use the ablative laser that wounds the skin. So when you use an ablative laser, the skin is wounded for at least a week to 10 days to treat scars such as these. Now, again, we're using a fractional laser. Only 50% density of the skin is removed. So the other half of the skin, there's areas of sparing in between. So half of the area being treated is totally untouched. And this can lead to softening of the skin. But the nice thing about it, in this particular gentleman's case, you can see the improvement of the white scars as well. A lot of the pigmentation has returned. Another example, looking at him from the other side, the same thing. You can see how the scars have softened, both on the face and neck. The fractional lasers that we use allow us to treat on the body, face and neck in particular. It does take longer to heal once you go below the neck, but it is possible to treat these depressed scars with this type of ablative treatment. So not everybody wants an ablative treatment because it requires more downtime. These patients are home for a week or so after each treatment. So you really have to plan with that in mind if you're going to be undergoing a treatment such as this. Now, we have another concept that we've been using where we do the ablative fractional, we're adding a topical filler to the skin. This is again that concept of laser-assisted drug delivery. Unlike what we showed for the pigmentation earlier in this presentation, this is an ablative laser used very conservatively, and while the little holes made by the laser are open, we apply a topical filler called Sculptra, and it helps plump up the scars so they get significantly flatter and more even to the skin surface. Years past, I never would have approached a patient like this. I didn't feel we had anything adequate to make a big difference, but I do think now we're able to make a very big difference for someone like this. And there are other options as well. This is the radio frequency with microneedling. These are where we put little microneedles into the skin and they're heated up with a radio frequency device. So the temperature in the skin gets up to maybe 40 to 45 degrees centigrade, so it gets quite warm. But the penetration of the needles plus the heat tends to soften some of these deeper scars and pitted scars. So it tends to work better for those patients with pitted scars, and also those patients with darker skin types. So moving beyond acne scars, there are other types of scars we use ablative devices as well, ablative fractional devices. We do a lot of surgery in our office. As Risa mentioned, we do Mohs surgery for skin cancer, and the patients are often left with scars like this that are acceptable, but they can be better. So here we use, with local anesthesia, the ablative fractional laser, and you can see after 1 treatment, significant improvement, and after 2, even further improvement. So this is a big part of our practice where we try to make our surgical scars that we create better. Here's a patient had a skin flap on his nose. He had a big defect on his nose from a large skin cancer. The plastic surgeon took skin from up on his forehead, moved it down to the nose. It was very thick. So we use the fractional ablative wounding laser to flatten this down quite a bit. This is just a single treatment session. This also was post-skin cancer flap reconstruction surgery. So there was a wound here after skin cancer removal. The surgeon took the skin from the upper part of the nose and cheek area here, moved it down to cover the defect, but the patient was left with what we call pin cushioning or thickening of this flap. And here I use something called an Erbium Laser, and this is a single treatment session, and you can see the improvement. Very, very nice flattening where it looks almost completely normal after a single treatment session. A depressed scar, where I actually combined techniques, where I took an ablative laser and I smoothed out the edges, then resurfaced or wounded the center of the area, and you can see how the scar has flattened out quite nicely without any surgery, all from laser therapy. Other scars, again, a skin cancer scar, not uncommon that you see these blood vessels around scars after surgery. Here I used a vascular laser to remove these blood vessels. Then we resurfaced the scar in the center, and the result looks fairly normal after a few treatment sessions. Here, a depressed scar on the chin, pre and post resurfacing to improve that change in texture. One of the great things about these fractional lasers is that you can treat children. So here's a kid who had a dog bite with scars on his face, and at the age of 4 or 5, we're able to treat these safely and effectively. So this was a non-surgical approach. These scars were not cut again. This is all a laser treatment to help smooth out these particular scars. And here again, a child who had a birthmark that led to some wounding or ulceration. And here, after a few treatments, this did require work under anesthesia in the hospital for a broader area. But you can see the nice improvement compared to here with this ablative fractional approach. So there's no reason for children to have to wait to adulthood to have these scars treated. Many of these kids can be treated at a young age. And this is a rather dramatic case by a colleague of mine, Dr. Ubelheuer, who did this work at the U.S. Naval Academy, or excuse me, U.S. Naval Base in San Diego, where they were treating wounded warriors. And this gentleman came back from war and he could not fully contract his hands, his fingers here. So he took one of these ablative fractional lasers, treated over this area, and the patient was able to completely tighten the skin to the hand in one treatment session. So a relatively new indication for laser treatment to improve the contractures that can occur. This is not good for all contractures of the skin, but can be helpful for some and something that needs to be pursued further. So this is typically a field that is growing rather rapidly. The indications continue to expand. The interest is quite high. I think it's something that many physicians need to know more about so they can offer these treatments to their patients, because I think that many of the permanent problems that people are dealing with should be considered something temporary, not necessarily permanent. So there's so much that can be done. And it's in many cases, it's so easy. One just needs the experience and the appropriate technology to make things happen. So I'm open for questions. I'm here. Risa, you have any questions?
Yes, thank you so much, Dr. Geronemus. There are a lot of questions for you. Some of these started coming in before you even got going, so they may be a little repetitive, but there's some very good questions. Thank you so much. Those photos are so impressive to see, and I hope they give a lot of you watching a lot of hope that your scars are treatable. If you do have a question, now would be the time to put them in Q&A. And without further ado, let's get started. I have a cafe birthmark on my forehead. I'm still waiting on Vava Laser to email me back.
Avava.
Yes.
So a Vava laser is still under investigation. It's not yet FDA approved. We are one of the clinical sites doing the studies on the device, but stay tuned.
Okay. If someone is on low dose Accutane, 10 to 20 milligrams to help keep their acne under control, but they still have a lot of acne scars, is it still safe to get subcision, TCA, or other combination laser treatments under Accutane? And if so, do you treat patients with some active acne without needing some of these cosmetic procedures?
Well, there's a big debate as to what to do with people on Accutane and treating their scarring. We generally wait until patients are off of Accutane. If we're doing an ablative laser, one that wounds the skin, if somebody does not require a wounding laser, in other words, a non-ablative laser, then we do treat while they're on Accutane. But it's best to wait until the acne is under control prior to considering any laser therapy.
This is a good question. So there's a bunch of questions about kind of cost and insurance. So could you maybe speak to if insurance covers any of these procedures for scars, and if any idea you can give for costs?
The cost can range depending upon the number of treatments. Usually there's a treatment charge per session. But a lot depends on how large the scar is, how many devices are necessary, and how complicated the scars are. So it could range from hundreds to thousands of dollars, depending on the type of scar and the extent of the problem. In terms of insurance, typically, unless there's a real functional reason, insurance companies don't cover these procedures. They're considered cosmetic rather than reconstructive. So you have to prove some type of medical necessity for the treatment.
Makes sense. Can colorless, a hypopigmented raised scar be treated?
It can be, not to complete perfection, but raised scars can be treated by a number of methods through the laser therapy, whether it be the pulse dye laser or an ablative laser can be very helpful for that. Sometimes a non-ablative laser can be helpful for that, used for that as well. And we do add injections quite a bit. So we'll give a combination of something called 5-fluorouracil and a little steroid called triamcinolone, mostly 5-fluorouracil, to help flatten those scars as well. For scars that are white in color, then the resurfacing lasers or the eczema laser could be helpful for that purpose.
Okay. I have a recessed scar after a large excision on my forehead and had my first CO2 laser session 4 weeks ago. How should I take care of it at home?
Well, 4 weeks ago, you probably should be healed, and it should be just red at this point in time. If the redness bothers you, that redness can be treated with a pulse dye laser. Otherwise, there shouldn't be any need for wound care at this point in time. But if you still have a wound, you should go back to your physician and find out what's happening.
Are old scars harder to treat?
Yes and no. I mean, old scars can do quite well. I treat scars that are 30, 40, 50 years old sometimes. I did mention that I like to treat acne scars in teenagers, but that doesn't mean that we can't treat scars in people who are older. So fresh scars do respond a little quicker, but it's still possible to treat older scars as well.
Here's an interesting one. I had a lip laceration and got stitches for it. It's red, but the main issue is that there is a small gap where the sides didn't close completely. Can lasers be used to fill in the line?
I'd have to see it to really know. That's a hard one to visualize. If it's very depressed, then sometimes having it cut out again or restitched is a reasonable plan, especially on the lip. Scars that are generally depressed, though, do have the potential to respond to laser therapy, usually an ablative laser.
Okay. Can lasers remove or reduce the size of a raised mole on your face?
They can be used to help flatten a mole. I don't mean to be evasive, but there are different types of moles. And there are some types of moles that flatten quite well with laser treatment, but typically they would not be removed completely if one tried to flatten them. And it's something that may come back with time. The most definitive way to remove a mole that's elevated and a little bit into the skin is to cut it out surgically. But there's some moles that respond quite well to laser treatment just in terms of improving the color.
So for that one, if you're not local, you could have a virtual consultation and maybe take pictures for Dr. Geronemus. Let's see, can you talk about if Botox is good for treating scars?
Yes, we do use Botox, not the way you use it for treating lines or wrinkles, but it can be helpful for reducing scars. And this is something that we've done some work on and have found it to be somewhat helpful. So what it does, it does minimize or inhibit the cells called fibroblasts that makes up scar tissue. So, we don't do it routinely, but if it's absolutely necessary, we'll add it to our therapeutic regimen, primarily because of cost. It would be quite costly to do.
Got it. Okay, here's a great one. What is the youngest age you would treat a child for a dog bite?
Many dog bites are initially red, and you could use the pulse dye laser very safely. I've treated, 1-year-olds with bites on their face, with mostly with reddish scars. If it's a very depressed scar and requires a resurfacing procedure, I may wait till they're 2 or 3. But we have used the pulse dye laser or the V-beam in patients with birthmarks as young as several days of age. So we have treated newborns. We do that routinely every day in our practice.
Yes, maybe good for a future webinar.
There you go.
And there's a lot of information on our website about how we treat very young children and photos. What is the best treatment for a keloid or hypertrophic scar on the body?
So those are 2 different things. Keloids are very raised and can also be very, very thick, elevated above the surface and below the surface of the skin. And those are very, very difficult to treat, very hard to cure. Sometimes we just give injections into those. Laser therapy typically does not offer significant benefit for keloids, but one tries to do the best one can in managing keloidal scars. Some physicians choose to excise them, then do laser treatment afterwards. Some excise them and do radiation therapy afterwards, which can often work quite well. There's often also a new medical therapy that appears to be very promising for very thick scars called Dupixent. And as you may have seen the advertisements on television, it's used for eczema of the skin in adults and children. But it can be helpful for scars as well, but it's not yet approved for that purpose. Now, hypertrophic scars are a much more common problem and much more treatable. Those are scars that are a bit thicker, thick, but not quite as thick as a keloid. They're usually slightly elevated above the skin surface, and there we'll often use the pulse dye laser in combination with injections. I have patients use massage and silicone gel as well. So the combined therapy can be very, very effective.
Do you also perform treatments like subcision or dermal fillers in combination with lasers for acne scars?
Yes, I do less of this, the typical subcision. I like the radio frequency with microneedling, which is a certain type of subcision unto itself by putting the needles into the skin and heating them up. But we do sometimes add injectable fillers into depressed scars as well.
Okay, you said to come in to treat scars early. So how soon after surgery should one come in? A couple of weeks?
I think it depends on the type of surgery. One thing you want to make sure, let's say someone had breast surgery or surgery on the chest, you want to make sure there's no tension on the wound, that the wound is fully healed. But some wounds actually are fairly well healed within 3 or 4 weeks. Post cosmetic procedures, I think early intervention could make a very big difference. Let's say, for example, you had a chemical peel or a laser procedure and you're developing scarring, then early intervention with laser therapy can prevent a long-term problem.
So speaking of breast surgery scars, someone's asking what would be your recommended way to treat a raised scar around the areola from a breast reduction surgery?
So we see a lot of that, and we treat them again with the pulse dye laser, with the injections, and the topical massage. And so that can be very, very helpful in those cases. I'm a little surprised that not more patients seek this treatment. I think a lot of the surgeons are more conservative in terms of their awareness or willingness to have their patients undergo treatment of these raised scars, particularly on the breast. But it's something that we do a lot of that can make a very big difference. The other thing we see commonly on the breast, a lot of, especially in darker skin types, is the scars often turn brown. And that's where we use that technique of the non-ablative fractional laser plus the topical solutions, which can be very helpful in lightening those scars.
All right, the questions are still flooding in. Can we keep going? I'm like,
Sure.
okay. This is a very engaging topic. So is it easy for you to predict the number of treatments that will be needed when you first see a scar?
It's very variable. You have to consider a number of factors. the type of scar. Is it raised? Is it depressed? Where is the scar? Pigmentation of the patient, tension on the scar. So you have to weigh all these variables into making your decision, but one can generally have an idea, but not a specific number in terms of what one might need.
Okay. How long after an Accutane course do you feel comfortable treating scars with laser cosmetically?
Well, I would use a non-wounding laser or non-ablative laser even while somebody's on Accutane. But I'd wait 3 months generally until somebody is off if an ablative or wounding laser is required. And again, there's not a lot of science behind that. And a lot of that also depends on the dose of Accutane. You mentioned earlier somebody was on a low dose of Accutane, 10 milligrams. That's a low dose, not likely to cause a problem. If somebody was on a much higher dose, 60 milligrams or so, then one would be more inclined to wait a bit before doing an ablative procedure.
Okay, so we have a couple questions about more at-home treatments, so maybe we can try and wrap these together. People are asking if silicone sheets or biocorneum, if any of those are effective to use at home.
I think they're helpful. Yes, I do recommend them as sole therapy and also in conjunction with the laser treatments that we offer. There's some very good evidence that silicone gel or silicone sheeting can be helpful with scars. I'm not sure it matters which brand is used, but I do think that the silicone, either through occlusion or something in the silicone, can be quite helpful for the scar treatment. So I do recommend it to many of my patients.
So here's another post-plastic surgery question. So I had a rhinoplasty procedure that left me with an indented scar along the nostrils. Do you believe laser treatment could help to improve the appearance?
Yes, I do. Typically in a situation like that, we use an ablative fractional laser and it can help improve those scars. That's something that we've seen quite a bit, not that uncommon. So it does require a local anesthetic office procedure. Takes about a week to heal. Will stay red for a while, then will require additional treatment, perhaps more than one treatment session, most likely.
Okay. So this person says you mentioned a lot about dark scars. Is there any way to make light pigment on the skin darker to match the skin tone? I guess they're asking for a white scar.
Yeah, I mean, there are some things that can be done. It's difficult, but there are lasers that can be helpful, whether it be a non-ablative fractional laser or even a conservative use of an ablative fractional laser. For example, I had a woman who came in today who had some white scars on her arm from some self-induced behavior, and we were able to improve her pigmentation quite nicely with an ablative fractional treatment. Not a cure, just helpful.
Got it. How do you decide whether to do erbium or CO2 for acne scars?
I'm use more of the CO2, mostly ablative fractional lasers. The thermal effect that I get from the carbon dioxide laser, I think, is preferable to what I see with the erbium, but I do use the erbium for certain types of scars. For example, some of the skin flaps that I showed on the nose were treated with the erbium laser and they can do quite well.
Great. Is there anything that patients can do to optimize their outcomes? I've heard of Retin-A.
Retin-A can be helpful in treating certain types of scars. I think it's something that's relatively slow. So if you're patient, you want to use it for a year or two, you will see some benefit. There's a lot of benefit to using Retin-A in general for rejuvenation of the skin and improvement of overall sun damage and texture. But I think lasers will get you to your endpoint much more quickly than topical Retin-A.
Okay, great. All right, we're going to try and get through a couple more questions here. I see them keep coming in. So at some point when we cut this off, you can still send your questions to us or have a virtual consultation, of course, with Dr. Geronemus or any of our dermatologists. So this one I might say wrong. I've dealt with excoriation disorder on my face, chest, back, and back of my arms. I now have some ice pick scars on my face and hypo and hyperpigmented scars in other areas. I'm waiting to come in for a consult with you until I no longer have the active excoriation. How much time would you recommend waiting?
Well, it's a very challenging problem because it's something that's self-induced, and the behavior really has to change before you can do anything meaningful to treat the problem. So, you know, I tell patients to wait at least 6 months once they've stopped scratching the skin. Otherwise, you know, it gets into a vicious cycle where you could do some nice work improving the scars, and then you're back to the starting point all over again, you know, if the behavior continues. So I would say 6 months from pure cessation of the behavior.
Okay. I have a depressed scar on my face from a doctor injecting a pimple. What is the best way to treat that sort of scar?
So that's called atrophy, you know, where the steroid went into the fat and you've lost some fat. Typically that resolves with no therapy. There are some things that you can do, but patience for the patient is the best possible approach. If you don't want to wait for that, then you can try a topical filler or injectable filler, which can be very helpful, but I don't think you need laser therapy for that. Sometimes we put filler in just to move things along a bit more quickly.
All right. How does a laser best treat a raised scar on the face caused by Zealous Electro Desiccation, or is cortisone better?
Uh, I think if the scar is raised and red, laser is going to work better. Cortisone can be helpful for thick scars, but can also create some redness unto itself. So, I mean, they're both helpful, and we combine the laser plus injections for the optimum outcome.
Got it. Okay, let's see. Someone here is asking if we offer services in New Jersey or if we can recommend someone in that area.
Well, we do have a couple of affiliated offices in New Jersey. I don't work there myself, but I'm part of the Naviderm group, and we have offices in Fort Lee and Millburn, New Jersey.
But we do have lots of patients from New Jersey and all over the country and all over the world that come in to see Dr. Geronemus. So we can definitely help accommodate you if you're an out-of-town patient as well. All right, let's see any last ones. Are the lasers that you've mentioned effective on black skin? Are there any additional concerns or limitations in treatments when treating a hyper and hypopigmented scar on black skin?
Yes, they can be treated, and yes, there are concerns. So you do have to modify your technology and your technique in treating skin of color. And it's not just black skin, it's Hispanic skin, Asian skin. One has to modify the approach to get the appropriate response. But there are options for patients of color for sure. But it does require either specialized technology and or specialized skill to do it appropriately.
Okay, great. Many dermatologists have lasers nowadays. How would one know if they're fully versed in its use and actually an expert?
So that's a really good question. I think you should have a straightforward conversation with your physician. You know, have you treated my problem before? Do you have the best laser for my condition? If you don't, is there something better that's out there? And can you show me photographs? Can you show me some of your before and afters to give me a sense or give me a degree of comfort in your skill set? And you can always get references from other physicians and or patients in terms of being able to confirm. That's also one of the things we're seeing in the field, is that there are people who are working outside their core specialty. So I'm a bit biased towards dermatologists and plastic surgeons in terms of their knowledge of the skin and their ability to understand some of the subtleties that we talked about tonight.
All right, last few questions. So what percentage improvement should someone expect from a CO2 laser for acne scars? And should less improvement be expected if we've had a Fraxel laser treatment beforehand?
So acne scars are very heterogeneous. So they can be broad, they can be rolling, they can be pitted, they can be depressed, they can be raised. So it's hard to answer that question because it depends what types of scars that one has. And as I mentioned earlier, one also has to alter the technique based upon the pigmentation of the skin. So somebody with darker skin may not get as aggressive a treatment as somebody who's has the skin that, like yours, Risa, where you're generally fair. So it's variable. In the studies that we did, where we used the ablative fractional laser that we published around 2010 or so, and we did the three-dimensional imaging of the scars, the depth of the scars improved by an average of 70%. But there are different types of scars. And pitted scars, the real ice pick scars, don't do as well with laser therapy. Sometimes they have to be excised, or sometimes they just won't respond as well. So I don't mean to be evasive, but the answer is very, very variable, depending on the types of scars that one has.
Got it. Okay, so there are more questions here, but we do have to wrap this up. So I just, any final words for anyone with scars, what they should look for a dermatologist when seeking treatment, and if it's worthwhile to come to someone like you, even if they're out of town?
Well, I mean, look, I'm not the only show in town. There are other people who are certainly well qualified to handle scars, but hopefully tonight I've given you the idea that one needs to mix and match the treatment based on the type of scar and to utilize the appropriate technology for the specific scar that one has in the context of your skin type. So there are many, many variables that go into offering the best possible treatment, but there are a growing list of options that are out there today.
All right. Well, I think you're being a little bit humble. I will say that we have patients all the time that come in and they have tried them elsewhere. Scars are very difficult to treat. So I do think it's could be a good idea to consider going to someone that is an expert. And because we have over 100 devices, that's why Dr. Geronemus is able to provide some of the very impressive results that he showed us.
Well, thanks, Risa. Okay.
Thank you. So anyways, I think the lessons learned today are to treat scars early. You can start as young as you need. There's no need to wait, and to make sure you go to a doctor who is an expert and has the right technology. Does that sound right? Good takeaways?
There you go. You got it. Okay.
All right, great. Well, thank you all so much.
All right, good night.
Please visit us on our website if you'd like to schedule a virtual consult or in-person consult with Dr. Geronemus or any of our colleagues. And we hope that you found this helpful. We have recorded it, so we will be sending that out via email in case you missed anything. And if not, we wish you all a great evening, and thank you so much for tuning in.
All right, have a good night.